Hi, my name's Jesslyn. I'm going to be your student nurse today, and we're going to put in an IV. I'm going to start by doing hand washing. I'm going to put my gloves on. Okay, I'm going to take my linen saver pad here. I'm going to place it underneath the patient's arm. I then will have her put her arm in a dependent position. I take my tourniquet here, place it 8 inches above. Okay, I'm going to palpate the radial pulse. I then will palpate for the distal vein. Okay. And if the vein isn't adequately dilated, I would then apply heat. I could lightly press on the vein. I also could stroke the vein from the patient's arm from distal to proximal. I also could have them close their fist in and out. I then will take off the tourniquet here, and I will prep the site. I'm going to do it in a circular motion for 30 seconds, letting it air dry. I then will reapply the tourniquet 8 inches above still. I'm going to take my catheter here. I will take off the top of it, making sure that the bevel is up. I'm going to take my non-dominant hand and I'm going to pull the skin taut, and at a 30-degree angle I will administer the catheter until I get flashback of blood. I then will make it level with the patient's arm, and I will continue on until the catheter is completely in. After that, I will start releasing the needle. I can take off my tourniquet, and as I hold it in place, I can take the needle and place it into my sharps container. I then am going to take my tubing and take off the cap. Holding it in place, I'm going to tighten my tubing. I then will take a piece of tape and tape it underneath. After that, I then can take swabs here holding the tubing, and I will get rid of any dried blood. I then will take my dressing or Tegaderm here, making sure not to touch the clear part because that is sterile. I will place it over top of my hub, making sure not to touch the clear, making sure to press down around the site, making sure it is all the way on. I then can take off the outer edge. I then could place a label on here with the date, time, the size of the catheter, and my initials. And lastly, I would take some tape and tape down the tubing here. All right, and that's how you do an IV.